Now, I'm now going to say a little more about the vocal folds, the vocal cords, and how important it is to look after them and how we can help to look after them with our diet and lifestyle. We've seen how hard they're working during the teaching day, so let's look closely now at the things we can do before we start to speak to help take care of our vocal health. Now, lining the vocal tract, there are lots of delicate membranes, and these can be easily aggravated by certain foods, very spicy foods, curries, chilies, and so on. So the night before lots of heavy-duty vocal work, a really heavy day of teaching, if you can, avoid spicy meals, the curries, the chilies, and so on. Acid reflux is another condition where stomach acid can come up through the food pipe and irritate the throat, possibly the larynx. You get a burning sensation in the throat or a sour taste in the mouth. So again, heavy teaching day, check the timing of meals the night before. Caffeine can dry the voice, dries our vocal area, and drinks that contain it, coffee, tea, cola, all will take fluid from the body. Yet ironically, what's the first thing we do at break time or lunchtime? Rush into the staff room and have coffee. So if you're having your tea or coffee, perhaps take some water too. Too much dairy produce can increase mucus production, and this can cause catarrh. So again, if you're using your voice regularly, minimize dairy produce, particularly if you're susceptible to that sort of condition. Alcohol dries the voice. Spirits are the worst, so drink water with wine. Italians do, and if you do want that drink, and why not, perhaps have some water with your alcohol. Now, obviously, tobacco, smoking, active or passive, will cause toxicity, and toxicity will attack the membranes of the vocal tract, and of course, will constrain the breathing process. Now, it's not surprising when you think of the average student or NQT lifestyle, late nights, working, preparation, takeaways, perhaps smoking, and then thrown into a teaching situation, often without any voice training. Why so many young teachers have voice problems, especially in that long autumn term. So a little awareness of diet and lifestyle can help here. The air quality can also affect our vocal tract. The vocal tract is aggravated by dust, by pollen, by chalk, or a very dry atmosphere. Central heating in particular, and other things, strong smelling fumes from solvents, petrol, all dry and all irritate. So when you're teaching, if you have control over your teaching area, improve ventilation, increase humidity, perhaps place bowls of water near radiators, houseplants and so on, and of course drink water. Have a glass of water on your desk. Now, tiredness, stress and emotions all reflect in the voice. It's difficult to breathe and speak effectively when we are under stress. Voice strain and dry throat occurs. Then the breathing rate and heart rate quickens with fear, anxiety. The larynx rises, and this causes the vocal folds to tighten, and so the voice sounds tense. This affects our confidence and makes us feel worse, more tense, and so on. So it's very important when you have a heavy teaching load to relax and check your posture. Medical conditions, of course, are reflected in the way our voice is produced. Asthma and allergies, well, these can all affect the larynx and cause swollen, inflamed membranes. Quite often prescribed medications, inhalants, steroids, and antihistamines all affect the voice. So consider this if you have a heavy teaching load. Consult your doctor, certainly, but do drink water. Keep those folds lubricated. Now, coughing. Coughing, obviously, if you have a chest infection, coughing is going to be necessary to clear the lungs. But a gentle huff is kinder than a harsh cough. If a cough doesn't produce anything, it's a moist cough, consider, is this a habit? Vigorous coughing and persistent throat clearing brings the vocal folds together very forcefully. This sort of thing. We've all done it. Throat clearing. It's unnecessary. It's bringing the folds together harshly with a risk of damaging them. So just swallow. Sip water. Suck a pastil or chew gum just to create the moisture. Now, obviously, you can't chew gum or pastils in a class, but chew them beforehand just to create moisture if you know you're prone to this anxiety throat clearing. And substitute swallowing for throat clearing. So no more colds and flu. Well, remember, anything on the packet that says it can dry up your cold will certainly dry up your vocal folds. So be very careful how you use these. Drink water. Keep the mouth moist. Suck pastils, not medicated lozenges. Inhale steam. It's very good for colds. Most important, reduce unnecessary talk. I said again, it's so common for teachers to feel that they've got to keep going when they feel dreadful, and this is always counterproductive. Now, laryngitis, of course, is very serious, and if you have the onset of laryngitis or just recovered from it, talking while suffering from this can cause long-term problems. So spend the necessary time in bed recovering fully. Do not answer the phone. Do not whisper, because whispering can strain the larynx far more than talking. Use the voice gently and sparsely when recovered. It's still going to be weak, so don't recover quickly and then just go back into a full teaching load. Now, should you experience regular or unexplained voice loss, a dramatic change in the vocal quality of your voice, hoarseness, for example, or very, very weak, tired voice for longer than 10 days or so, do see your GP. If you have pain, see your GP. If there's no improvement after 6 weeks, then ask your doctor to refer you to an ENT consultant, ear, nose and throat specialist. It may be you need specialist advice. You may be referred to a speech and language therapist, but don't let those conditions go untreated. So be aware of these factors. Think about what you're eating. Think about all the things that you can do to help take care of the vocal folds and the vocal tract.